Hi there, good afternoon. Thanks for joining today.
Hello.
Okay, so welcome to an introduction to virtual reality in therapy. My name's Alex. I work alongside a team of psychologists and IT developers at Psious, a virtual reality therapy organization, and we're located in Barcelona in Spain. Our objective as an organization is to improve mental health treatment using technology. So I'm just going to wait a couple of minutes to see if anybody else is going to join us. We have a few people, mostly from the UK, joining us today, which is great to see. And shortly I will begin. Okay, so we're just going to wait 2 minutes. What I'm going to do, I'm just going to open up a chat at the bottom of the screen. And I just want to make sure that everybody can hear me okay. So if you could just reply yes or no in the chat that pops up on the bottom of the screen there. Okay, perfect. Everybody's looking good. If at any point you have any questions or would like me to stop and go over anything again that I'm talking about, just use this chat box, type your question in and I can stop and address it, and we can review anything. If I'm going a little bit too fast, just tell me to stop and we can go over it again. It's no problem at all. Okay, so I'm just going to make sure that everybody's microphones are on mute and we can get going. Perfect, everyone's done that themselves. Excellent. So we're currently looking at one of the best times in human history. Technology is advancing so fast and at the same time is becoming so accessible that machines that once seemed like science fiction are now available in every single household today. So in healthcare, these technological advances are having profound effects and transforming human life as we know it. So today, we just have a few more people joining us. That's great. So today, the aim of this class is to introduce you to virtual reality if you've not had any experience in using virtual reality before, so you can get a better understanding of how it's currently being used to enhance and improve therapeutic treatments in clinics worldwide. A number of you are mental health professionals, so it's excellent to see that you're joining us today. Before we get started though, what I'd really like to see if anybody who's joining us today has got any experience in using virtual reality at all, whether or not that's for entertainment purposes, whether it's for movies or video games. So if you have any experience in using virtual reality, in that chat box at the bottom of the screen here, I'd just like you to put yes or no, just so I can gauge an understanding of whether or not everybody has tried virtual reality before or if it's something that's completely new. That's great. And for those who have tried using virtual reality before, was this for therapy? Okay, so we're looking, it's about 50-50 for those who have tried virtual reality before, and as far as I can see, nobody has actually tried it in therapeutic application before, which is great, which means today it should be really helpful for you to sort of learn a little bit more about how virtual reality can be applied in therapy. It's not uncommon at all for people to have no experience in using virtual reality, and especially not uncommon for people to have no experience using virtual reality in a therapeutic or medical field. So, although virtual reality is now commonplace in a number of medical fields, like in surgeon training and in pain distraction, such as at dentists, it's very popular across the US. In psychology, this new evidence-based approach is only available in certain clinics in the UK at the moment, despite it being used in practice for over 15 years now in other countries. So for those who are completely new to the idea of VR and have no experience in using virtual reality before, I'd like to explain a little bit about the technology before I explain about its use in therapy. So virtual reality, it puts the user into an environment which is completely different to the one that they are actually in. This can be a computer-generated environment, or it can be a video filmed with a 360-degree lens. So nowadays, the most common way that users experience virtual reality is using a headset like this one here. Okay, previously, about 20 years ago, headsets were very clunky, heavy, expensive, and not easily available to be used in everyday situations in your home or in your office. But this has all changed now thanks to innovation from companies like Samsung with their Oculus project. They've now developed lightweight and streamlined headsets which can be accessed by pretty much everybody. Okay, so this technology can be picked up relatively cheaply online. And the way the headsets work is they work just like the human eye, where an image is projected on the outer side of the headset. And inside the headset, I don't know if you can see there are two lenses. Okay, and these lenses, they add dimension and depth to the image which is projected inside the headset, making the environments completely lifelike, just like how your eyes work. Also within the headsets, nowadays, they have motion sensors which are built in. So this means that the headset can sense the direction the person is facing. So if they move their head to the left, the image that's portrayed within the headset also moves to the left as well and changes exactly with the person's perspective. So additionally to the visual senses, extra stimulation like sound can also be added to enhance the feeling of total immersion in these environments. So the environments that are available in virtual reality, they can also be interactive as well. So this gives the user the sense that they are moving through the environment and they can interact with things in it. Our brains, they truly perceive these new worlds as real, hence the name virtual reality, and you become a participant within the new environment. So we've had a few other people join us just in the last minute or so. If you've missed the first 5 minutes, what I want to do is I just wanted to check to see what everybody's experience with virtual reality is. So if the two that just joined us could just let me know, have you any experience using virtual reality in therapy before? I just want to make you aware there's a chat that you can use to stop me at any time and ask any questions at any point during the class. No, so I'll take it that they haven't any experience in virtual reality. So like all technology, all new emerging technology, it can seem a little unusual at first. And if you've ever seen anybody wearing a virtual reality headset from the outside, if they're sort of moving their head and their arms around, not in sync with the actual environment that they're in, it can seem a little bit strange. But what's going on the inside of the virtual reality headset is a different story entirely. It's a truly immersive world that the brain perceives as being real. So now you know a little bit about the technology and how it works. I want to give you a short rundown of what has already been explored and what has already been researched in mental health and how virtual reality is making huge waves in the treatment of various conditions. So the use of virtual reality to help those with mental health conditions dates back around 20 years or so. Like most technology, its original development was by the military in the USA. So they have a system which is now called BraveMind, which BraveMind, it helps soldiers returning from Iraq and Afghanistan suffering with PTSD. So it allows those returning from conflict to relive what they went through in a safe and controlled environment. For a number of years now, virtual reality and PTSD has been studied and tested, and there's numerous results to show that the virtual exposure, it causes reduction in the radical emotional responses to these events, which previously would have caused extreme distress in the soldiers returning from these traumatic events. So it's not just PTSD, that was its original development, but since then there's been sort of a far wider reach of virtual reality to be used to help a huge range of mental health conditions. If you've been following the news at all and following the developments of virtual reality in therapy over the last year or so, it's really exciting stuff that you'll be able to see that last month NHS centres in Oxfordshire and in Buckinghamshire, they've recently began using virtual reality to treat acrophobia, the fear of heights. Okay, so in our compilation of virtual reality research and peer-reviewed journals, which if you haven't seen yet, I'll send out an information email to you after the class so you can access a huge range of different studies and peer-reviewed journals that display the effects of virtual reality in a therapeutic setting. Oh, we just got one person joining us here again. And so the studies that have led to using virtual reality to cure acrophobia, they show that in vivo exposure therapy to treat fear of heights is just as effective as the virtual exposure therapy in a controlled trial. So we've got, sorry, I'm just going to stop and answer Annie's question. Yeah, so the program that I mentioned that was developed by the military is called BraveMind. There we go, I'll type it in the chat there. So yeah, the program developed by the military to help those suffering with PTSD is known as BraveMind, and this was one of the original developments of virtual reality to be used to help mental health conditions. We've come a long way since then though, so like I mentioned, it's currently now used in NHS for acrophobia, and another case study that we've seen is the use of virtual reality in children with ADHD who are finding it very difficult to pay attention or stay focused. So here again, virtual reality can help. We have a case study with an 8-year-old boy who was referred to a number of different professionals with no progress because he would lose interest in the treatment very quickly. But when he was exposed to using virtual reality, it really captured his interest, probably because there is a link between using virtual reality in entertainment, like in gaming and that sort of thing. And we find it really captures the interest of youngsters with ADHD. So to treat this kind of condition, there are developments in relaxation and in mindfulness environments which can capture the interest of these types of patients, and they can put them into a state of calm. So this state of calm that they enter when they're viewing the virtual world is then continued after they take off the glasses. So the state of calm and concentration remains, and with increased exposure to this and numerous sessions over time, this is something that can be maintained for a very long period of time. So there are many more conditions that virtual reality can be used to treat, which I will show you shortly. We'll go into it in a little bit more detail. In the chat though, now I'd just like to get a bit of an understanding of what it is that everybody here does on a day-to-day basis. So in the chat, I'd like you to write sort of what are the common problems that your patients come to you with, whether that's sort of anxiety, eating disorders, insomnia, depression, phobias, just so I can make sure that the environments that I'm about to show you in our virtual reality platform are specific to you guys. So yeah, what are the common problems that your patients come to you with? And in answer to your question, Annie, yes, I can provide a link to that study. Thanks for the response there, everybody. Okay, so one that I'm seeing commonly, and from working with a lot of psychologists around the world, we are seeing an increase in anxiety in a number of clinics at the moment. So it's depression and anxiety, which are really at the forefront of treatments at the moment. So we have a number of different ways that virtual reality can be used to treat anxiety. Okay, so it can be used as an exposure therapy treatment, okay, whereby, like I mentioned earlier, you are completely immersed into an environment. So you would be immersed, the patient would be immersed into an environment that brings up feelings of anxiety or uncomfortable feelings. And through exposure to these situations, the patient can then learn to overcome them in a safe and controlled environment along with a mental health professional. Okay, mindfulness exercises and relaxation are also very effective in dealing with feelings of anxiety. And as virtual reality technology is now becoming so much cheaper, it's much easier to apply in private clinics, as the equipment that you need is now sort of very, very readily available. So a laptop, a virtual reality kit, and an internet connection is generally all you would need in order to carry out a virtual reality therapy session. So on the screen here, you should be able to see on the right-hand side some examples of environments that we have developed at our organization, Psious, which can be brought up in the virtual reality headset to allow patients to overcome their feelings of either anxiety, their phobias, or other conditions. So as you can see here, we have an example of a bar or restaurant scene, which is particularly effective in treating those patients who become very anxious in social situations. The next picture to the right is one of our augmented reality environments, which shows a spider on my desk, okay, which is what the patient would see when they're wearing the virtual reality, and it's particularly effective when treating fear of spiders, fear of flying, and as you can see, the New York skyline there, which is an environment to help treat fear of heights. So Psious has been running for 6 years now. It originally, in answer to your question there, Annie, the majority of our environments are virtual reality environments, but we do offer augmented reality environments as well. And the difference is that with virtual reality, the environment is completely computer generated or a 360 video, whereas in augmented reality, what you see is the actual environment you are in, whether that's the therapist's counseling room or your own living room, wherever. And with augmented reality, it's similar to virtual reality, but you see the actual environment you're in, but with another layer added on top of it. So as you can see in the spider photograph on the screen there, that's augmented reality. So in the headset, you would be able to see the actual desk, but there'd be an extra layer, a digital layer implanted on top of that. So moving on then. So what is it that we do here at Psious to develop virtual reality and to help people overcome their anxieties, their phobias, their eating disorders, and their trauma? So we've been developing virtual reality environments for more or less 6 years now. Okay, our platform is online and easy to use. We also offer assistance in providing kits, and it's been proven that using virtual reality in a therapeutic session delivers effective and lasting results. So I often find that speaking to a lot of therapists, it can be very difficult or complicated to carry out exposure therapy. Now, this is because if you imagine if somebody comes to you with an anxiety disorder or a phobia where they're afraid to get on an aeroplane, taking them onto an aeroplane every single time you want to carry out some sort of exposure to that situation with them would end up becoming very expensive. Also, imagination exercises become a lot easier when using virtual reality as a tool. If your patient is finding it difficult to imagine a certain situation that evokes thoughts of anxiety that you want to talk through with them, it's much easier for them to visualize this situation in a virtual reality headset than it is to imagine it. It really helps you guys as therapists as well in these situations because you also visualize what the patient is seeing as well, which makes it easier for you to teach them how to handle their thoughts about that certain situation. So I'm going to bring up an example of the Psious platform now for you to have a look at on my screen here. Okay, one moment. And I'm going to go ahead and connect the headset as well and give you an example of what a therapy session with Psious actually looks like. Okay, so now I've connected the headset. As you can see here, all of the different treatments that we offer become available. Okay, so as you can see, we have treatments for acrophobia, the fear of heights. This includes environments such as a glass elevator, rising up and down different levels of the building. I should mention before I go any further as well that all of the environments have parameters in that the therapist can control. So these different parameters stimulate different responses from the patient. And these responses are what you and your patient can then talk about before and after the therapy session to help them handle their thoughts about these situations a lot better when it comes to them experiencing them in real life in the future. So we have treatments for acrophobia, the fear of heights. We have treatments for the fear of flying, which includes environments for being at home before getting on the plane, traveling to the airport. It includes an environment for waiting at the airport boarding gate, and then the environment of walking down the tunnel. And the patient actually feels like they're getting onto a plane, it's taking off, and you can control various parameters in that as well, such as sort of adding turbulence, making it a stormy day. And eventually this will really help the patient overcome their fear of flying. We have environments for social anxiety, okay, which is like I mentioned earlier, the bar or restaurant scenario. We have environments for the fear of needles, which is a hospital setting where the patient would, in virtual reality, be experiencing a blood draw. Generalized anxiety, We have fear of animals, which includes for the fear of spiders, cockroaches, and dogs. Fear of driving. OCD, which I know a few of you mentioned that your patients come to you with. So in this environment, the patient would be exposed to an environment where they would go into a dirty bathroom. Other environments can be adapted for this as well, like going onto the underground, onto the tube, onto the metro, which also could be perceived as a dirty environment as well. So we have fear of public speaking, which includes environments such as an auditorium, for public speaking in front of a large crowd, but also for public speaking in front of small crowds as well, like an office environment too. So we have test anxiety, which is particularly effective for students who are coming up to exam time if they have any anxiety that's due to schoolwork or tests. Agoraphobia, fear of darkness. Claustrophobia, which includes environments such as a small lift setting or a room where the walls gradually get smaller. And then we have our mindfulness distraction exercises as well. Our mindfulness and distraction environments include mindfulness exercises which help lower anxiety levels, improve focus, improve concentration, and teach patients how to handle their thoughts. Okay, our latest environment that we've just added is our eating disorders environment. Okay, and this includes a dressing room setting, and also it includes a setting for a restaurant as well, where the patient would order high or low calorie meals depending on the parameters that you, the therapist, can control. So to show you in a little more detail what I'm going to do, I'm going to open up the fear of flying treatment as if I were with a patient now. Okay, and as you can see, here are the different environments here. Okay, so let's imagine we're going to be helping a patient today overcome their fear of getting onto an aeroplane. So we would launch the scene here, and in the virtual reality headset, the patient would see what you can see on the right-hand side of the screen here. I should point out as well that the graphics on the virtual reality headset are far more realistic than the graphics that you see on your display, simply because we want to make sure that the internet usage or the bandwidth when using this is prioritized for the headset and the mobile phone that's attached to the headset rather than the laptop computer, just to make sure that the process for the patient is as seamless as possible. So an example of what you would see as the therapist is on the screen now. Okay, below the snapshot of what the patient is seeing are the different events that you can control as the therapist. So you can make it daytime, you can make it nighttime, and then you can control the different events that the patient will experience going through this treatment session. Okay, so you can make the plane begin taxiing, and if the patient is to turn their head to the left, if you move the goggles to the left, they can see out the window there. Okay, I don't know if you can hear as well. I haven't got the headphones plugged in, but there is also audio, similar to as it would be on a normal aeroplane, asking people to fasten their seatbelts, put up their tray table. So we make the experience as realistic as possible. Okay, as these different events are being controlled by you. Oh, Albert's just got a question there. So the virtual reality headsets that the system is supported on, I'll come to that in just a moment, but yeah, and all of that information I'll be able to send to you in an email after this as well. So just one moment, Albert, and I'll be able to cover sort of the virtual reality kit that's needed in order to carry out these exercises with your patients. Okay, so as you change the events that are happening in the experience, what you can also do is measure the patient's anxiety responses, okay, both subjectively and objectively by, first of all, subjectively, by asking them on a scale of 1 to 10, how anxious do you feel? So these responses I'm just going to annotate it here. In this part of the screen here that I'm circling, the responses can be monitored. Okay, so you would ask your patient, how anxious are you feeling on a level of 1 to 10? And as the plane is taxiing, about to take off, they may say, you know, I've got an anxiety level of 7. Which is recorded on a graphic here. Okay, as well as the subjective responses from the patients, what we also offer is a biofeedback response as well. So that would measure the GSR response of the patient. So you would get an objective response for the level of sweat that the patient is emitting out of their finger, which gives you an accurate anxiety level reading as well. And the two can be compared as well. What's excellent is that these reports can all be saved also, allowing you to show your patients that they are making genuine improvements over periods of time. Okay, so as you can see, let me clear that. So here is an example of the reports that can be saved monitoring the patient's anxiety levels over a period of time. One at the top of the page here, as you can see, the anxiety level was very high in the patients. Their responses were responding sort of 8s and 9s at the start of the treatment, whereby in the second session, after gradual exposure to the environment that's causing them high levels of anxiety, you would see a drop in the anxiety levels. And by session number 3, where previously they were reporting anxiety levels of 8s and 9s, the patient is reporting anxiety levels of much lower numbers. Oh, one moment. Of much lower numbers in this one. Okay. So it's a great way to measure the physical response and the subjective response of the patient. And it's also a great way for you to demonstrate to your patient that they are making genuine improvements as they go through therapy. This is really handy because we find that speaking with a lot of other therapists, patients may drop out of sessions or may drop out of treatment early because they don't feel like they're making improvements fast enough. If you can give them a projected goal, and if you can show them that they are making fast improvements using these graphics, then it's a great way to keep these patients on board with you. Okay, so I'm going to give you an example of what it is the patient would see in, sorry, we just have a question. Okay, in answer to your response, Trish, for the physical response, it's measured using a GSR e-sensor. Okay, so this measures the level of sweat. It measures minute changes in levels of sweat, which is attached to the end of the patient's finger. Okay, this biofeedback sensor would then be attached to the mobile phone, which is included in the kit, which is attached to the virtual reality goggles. It acts as the screen in the goggles, and that physical response from the biofeedback sensor to the mobile phone is then sent via Wi-Fi to the computer, where it is recorded as part of the session. Okay, on the screen now, I'm just going to show you something similar to what the patient would see, although what the patient would see, they would be able to move their head around and look left and right. But as you can see here is an example of the aeroplane taking off as if the patient were looking out of the window, just to give you a bit of a better idea of what the graphics look like in the virtual reality goggles. As you can see here, the event has been added for turbulence, so it's a great way to see exactly how the different events can be changed. Okay, and you can see the weather has been set to a stormy day as well. Okay, so moving on then, in terms of the training that Psious offers, if you did want to start using virtual reality in treatment sessions, okay, we have a team of experts here who offer webinars and training courses throughout the year with the Psious platform. Okay, as you can see here on the screen, we have a number of webinars coming up, the next one being on 3rd of July, and it's how to use Psious effectively with a patient. Okay, we also make available various training videos and manuals, and next I'm going to show you the Psious knowledge base. Okay, so on the screen here is the Psious knowledge base. As you can see here, this includes manuals for all of our different types of treatments. Okay, whether that's fear of public speaking, fear of animals, social anxiety, OCD. We have a manual which goes through exactly how to use the headsets and exactly how to conduct a treatment session for these types of patients. Okay, also available in our knowledge base are various downloads and guides as well. So we have visual resources, we have training guides, we have marketing guides. If anybody was interested in using Psious as a tool within their treatment sessions, we're able to help you guys by providing you with marketing guides on how to promote yourselves as virtual reality therapists in your practice and in your area. Okay, so we have so onto the kit that's needed then. Okay, I know I had a question about this earlier. So in order to use the Psious platform and in order to deliver virtual reality therapy to your patients and carry out these kind of exposure therapies, or whether it's exposure therapy, mindfulness exercises, relaxation exercises at the end of a session, there's various different ways that virtual reality can be used in a session. But in order to use it, what you would need is a pair of 3D goggles. Now, the goggles that we recommend using are the Samsung Gear virtual reality goggles. Now, you are able to pick up a pair of virtual reality goggles for next to nothing online, about 30, 40 quid. You can pick up a pair on Amazon. Okay, but what is also needed is an Android smartphone to run the Psious app if you wanted access to the 20 or 24 treatments that we provide. So a Samsung Galaxy S6 or later smartphone is ideal for running the app. It's what we tested on. And then if you want to record and monitor the patient's responses and their anxiety levels as well, then a biofeedback sensor is also required as well. This kit is something that we can provide to you if you were interested in implementing Psious in your practice. Okay, like I said earlier, we're based in Barcelona in Spain. Okay, and we can ship it out to you. Excellent. So that concludes the class for today. Okay, like I say, if there's any questions or if anybody would be interested in hearing more about virtual reality therapy or the work that we're doing here at Psious, you know how to reach me. I've got your email addresses. So after this presentation, what I can do, I can send out a recording to you, as well as a little bit more information about what it is that we're currently doing. And like I say, if you have any questions at all, feel free to get in touch with me at any time. So thank you for joining me today for this class, and hopefully we'll be able to do something similar again in the future. And I look forward to hearing your feedback. Okay.